Did you know that kidney disease often shows up on your skin, eyes, breath, and even your ankles long before any lab test is ever done? In fact, many of my patients come in for something completely unrelated, and after a quick exam and a few simple questions, I can already see red flags for kidney dysfunction. It's called the silent killer for a reason because by the time symptoms get severe, the kidneys are already in trouble. Here's the shocking truth. 1 in 7 adults in the United States has chronic kidney disease, and the majority of them, around 90%, don't even know it. That means millions of people walking around every day with signs their body is trying to give them, and no one is listening. As a doctor, I've seen how devastating it is to catch kidney disease too late when patients are facing dialysis, or worse. But I've also seen how early detection can completely change the story. So, in today's video, we're going to talk about 17 visible signs of kidney disease symptoms you can actually see or feel for yourself. I'll explain what each one means, why it happens, and how you can spot them early. Whether it's something you've noticed in yourself or someone you care about, this knowledge could save a life. Let's dive right in. One of the most common signs I see is swelling in the ankles, feet, or legs. This happens because your kidneys aren't removing excess fluid efficiently, so it starts to pool in the lower parts of your body. Think about it. Gravity pulls fluid down. When your filtering system isn't doing its job, your body retains salt and water, leading to what we call pitting edema. If you take off your socks and see deep indentations or puffiness around your ankles, that's a sign to pay attention to. Another early and surprisingly overlooked symptom is puffy eyes, especially in the morning. This isn't just about sleep deprivation. It could mean your kidneys are leaking protein into your urine, a condition called proteinuria. Healthy kidneys normally prevent protein from escaping into urine, but when they're damaged, it's like a torn coffee filter, letting vital proteins leak out. That fluid imbalance shows up around your eyes. Next up is dry, itchy skin. Your skin is one of the first places to show when your body's chemistry is off. When kidneys aren't balancing minerals like calcium and phosphorus, or when waste builds up in the bloodstream, your skin can become excessively dry and itchy. I once had a patient who tried every lotion and antihistamine before we found the real issue. Her phosphorus levels were dangerously high due to early kidney dysfunction. No cream was going to help until we treated the cause. Then there are changes in urination. If you're going more often, especially at night, or if your urine is foamy, dark, or even bloody, don't ignore it. Healthy kidneys produce clear, light yellow urine without bubbles. Foam can mean protein in the urine. Dark or bloody urine may point to damaged filtering units. If your urine looks like cola or smells off, it's time to call your doctor. Blood in the urine, even a pinkish tinge, should never be dismissed. It often signals inflammation or damage to the nephrons, your kidney's filtering units. Fatigue is another major symptom that's often misunderstood. When kidneys fail to produce enough erythropoietin hormone that triggers red blood cell production, you get anemia. That means less oxygen reaches your body. So if you're sleeping fine but still feel exhausted climbing stairs, this could be why. You might also experience shortness of breath. This happens either from anemia or from excess fluid backing up into your lungs. Patients often say they get winded just bending down to tie their shoes. This isn't just aging or being out of shape, it's a deeper issue. Another strange sign is ammonia breath, or a metallic taste in your mouth. When waste builds up, a condition called uremiate can affect your saliva and how food tastes. People often lose appetite or say meat starts to taste strange. I've had patients skip meals without even realizing why. That's a red flag. Nausea and vomiting are classic symptoms of more advanced kidney dysfunction. It's not food poisoning. Your body is literally being poisoned by waste products it can't eliminate. Muscle cramps, especially at night, often result from imbalanced electrolytes like calcium or potassium, both linked to kidney health. If you're waking up with leg cramps regularly, don't brush it off as dehydration. A loss of appetite is common. As toxins build up, your digestive system slows and food becomes unappealing. Combined with nausea and fatigue, this can lead to unintentional weight loss. High blood pressure is both a symptom and a cause of kidney damage. The kidneys help regulate blood pressure. When they're damaged, pressure rises, which then worsens kidney function. If you've developed hypertension for no clear reason, it's worth checking your kidneys. Mental fog or trouble concentrating might seem like stress or aging, but low oxygen levels and uremia affect brain function. Your kidneys play a bigger role in brain health than most people think. Trouble sleeping can also point to kidney issues. When toxins aren't filtered, they stay in your bloodstream overnight, causing restlessness, insomnia, or even leg cramps. Believe it or not, frequent hiccups can occur in severe kidney dysfunction. It's rare, but I've seen it firsthand linked to high urea levels. Dark circles under the eyes could be another clue. Anemia reduces oxygen to the thin skin around your eyes, making you look exhausted even if you've been sleeping well. And finally, changes in body odor. When your kidneys fail, your body tries to eliminate toxins through your sweat. This can lead to an ammonia-like smell. It's not poor hygiene, it's your body signaling internal trouble. If any of these symptoms sound familiar, please don't panic, but don't ignore them either. Early detection can truly save lives. I've seen patients turn things around completely with changes in diet, hydration, medication, and lifestyle. And it all starts with awareness. If you haven't already, please subscribe. Every week, I share clear, doctor-backed advice on how to spot and manage serious health issues before they spiral out of control. And if this video helped you, share it with someone who might need it. It could make all the difference. Next, check out my video on best and worst foods for kidney health. I'll walk you through what to eat, what to avoid, and how to support your kidneys naturally. Your body is always communicating with you. You just have to learn how to listen. And now you're one step closer. Thanks for watching, and take care of your kidneys. They're taking care of you every minute of every day.